The new BVI Health Services Authority Board met with the media for the first time on Friday, June 8th. Chairman of the board, John Klein, and Director of Hospital Services, Cedrine Patricia Malone-Smith, presented the board's plans for addressing healthcare in the territory.
The BVI Health Services Authority sees itself as the primary healthcare provider in the territory. Chairman of the BVI Health Services Authority, John Klein, says their plan is to significantly reduce the need for locals to seek quality healthcare in other countries.
I think that healthcare in the BVI has a great future, and the people can look forward to us fulfilling our vision. And our vision really is to be the primary healthcare provider in the territory. That we will be able to significantly reduce the amount of travel that people have to do, whether it's to the U.S. Virgin Islands or Puerto Rico or the U.S. mainland, to find good health care.
Making bills available for hospital patients is one of several areas that are being addressed by the Health Services Authority.
We have a lot of people complaining that they don't receive bills. That's important to us because in order to deliver good health care, it's going to take money. And we want to ensure that people are being billed, they can receive a bill, and not do it and not receive a bill 2 or 3 years later. So there are those things that we will need to correct.
Over the past 2 years, the BVI HSA has acted on the public's concerns about the long waiting time at emergency room. Director of Hospital Services, Pat Malone-Smith, says there is now a fast-track system that allows walk-ins who do not require emergency treatment to receive service in a timelier manner, reducing the long wait at the emergency room.
If we determine that you are not in need of emergent care, you become a fast-track patient. The ER is set up with 2 zones. The fast-track zone is to my left, and the emergency zone is to my right. So you come in, I've had a cold for the last 2 weeks and I just can't get rid of this cough. You're going to the left, to the fast track. There's a doctor in the fast track, and fast track is treated like a little quicker than a outpatient clinic. So you get assessed. If you need to have x-rays, if you need to have blood work, all the same things are done in fast track, but the doctor is concentrating just on those patients. And the patients that came in with the laceration, the chest pain, the shortness of breath, they can be seen sooner on the other side.
The health officials made an appeal for residents to invest in health insurance, which often determines the type of health care one would receive if the need for overseas attention arises.
Insurance goes a long way in determining where somebody can go when you transfer somebody off island. So when you don't have insurance, and we have to start looking for where we can send you, then it becomes an issue for the family in terms of finance. And what can I afford when I'm sending my loved one abroad? And it's for me, it's always painful because I'm always involved in the process in some manner in terms of trying to help this family decide how do we gather up the funds that we need to get your loved one to a higher level of care, because we've done everything that we can do. Just FYI, a little bit of information. If you don't have air ambulance insurance, MASA, an air ambulance flight from here to Puerto Rico is $5,900, $5,900. And they're not leaving Puerto Rico without knowing that they're going to be paid. If I have to send you to Miami, that price becomes $20,000. If I send you to Jamaica, it's $18,000. That's just the air ambulance to get you out of here. Okay? And like the minister said in his press conference, in his reading I saw yesterday on one of the online papers, one hospital did ask us for a $300,000 check in order to transfer a patient to them.
According to Malone-Smith, through partnerships formed with other healthcare providers, both locally and abroad, People's Hospital is capable of providing most services for its patients. The hospital also has access to specialists for the services it cannot provide. This is Walter Barrett for JTV News.